All right. Well, thank you so much. We are going to get started here. I'm very excited to be able to share some information about COVID-19 in our schools with some of our experts in our community. We have a couple of doctors from Lakeview here with us, as well as Jill Tim from Washington County and Paula McDonald from Stillwater Schools. So I'm going to turn it over to Dr. Heller to get things started today.
Hello, everybody. I am Abby Heller. I'm one of the OBGYNs at Stillwater Medical Group. And I am fortunate today to be able to share with you guys our experiences with COVID so far and hopefully empower you and maybe relieve some anxieties or just help you to feel like you're going to get through this and we're going to be okay. So we're going to get started with talking about coronavirus. What is the district plan to keep us safe? How do we protect ourselves? And addressing some testing concerns as well. And before I get started, I just want to say a big, huge thank you to all of our teachers. I know I have a huge vested interest in our district. I have a 5-year-old that's going to be starting kindergarten at Anderson and an 8-year-old that'll be starting 3rd grade at Anderson, both doing the hybrid. We're going all in on the hybrid. We'll see how it goes. They mean the world to me, as they do to you. And I just want to make sure that our district has the best safety plan we can while keeping our children engaged as much as possible. I think we've realized with distance learning in the spring how difficult it is for kids to learn from a distance. And how important our schools are for more than just education. So I'm really hoping that this goes well, and I hope that you guys feel as prepared as you can. So let's get started. So what is COVID-19? Other than being the virus that turned our lives upside down and seemed to poke holes in the fabric of our society, right? It's a virus. It's kind of a relative of the common cold. It's just a bad one, a really nasty relative. This virus started in animals, and any virus that starts in an animal and goes to a human is a much more virulent virus, meaning it infects really easily, and the symptoms that it causes, our bodies just aren't ready to handle those. So it expresses itself in bad ways. Not everybody, however, feels this way when they get the virus. Some people, it is just a cough, some mild shortness of breath, maybe a lack of taste or smell. Some people even just have more of a diarrheal illness. But then there's others who get very ill from it and require hospitalization or potentially even a ventilator to help them through it. The people that get the most ill tend to have chronic underlying conditions. This is our high blood pressure, diabetes, obesity, immunosuppressed populations do get very ill, more so than our young and our healthy individuals. Also, the elderly get very ill from it. So overall, we're still learning about this virus every day. We all know this. We see it in our news feeds, in the papers, if we're still reading the paper, but on our iPhones at least. The virus is novel and it's new and we're figuring it out, and we're trying to come up with vaccines as well, but we don't know yet. And I think that's the hardest part of this virus, is that there's uncertainty around it. So overall, when we look at cases in the region, we can see here on this map, Washington County, we have 2,715 cases. This was data, I think, that was released as of yesterday, potentially. As you can see, we have a lot less cases than some of the other surrounding communities and counties. However, we don't have as many people as those counties. So this is just a point in time. I'm going to have Jill Tim talk a little bit more about what that means for us.
Good morning, I'm Jill Tim. I'm the nursing manager with the Washington County Department of Public Health. And I'm happy to talk a little bit about the data. And I think one of the most important things to emphasize is that the data is a look at one point in time, as Dr. Heller said. And we know that it only tells us what we know today, and we'll continue to get more information about cases. And the Department of Health and the Department of Education have been really good about letting us know that the data is important and we need to pay attention to it, but it's only one piece of information that we're using to plan best options for schools. There are a lot of other factors that come into play, but we do know that as people are recognizing symptoms of coronavirus, it's taking time for them to decide to be tested. We know that it takes a while to get results of the testing, and so the data that we have is the best information that we have and can use to make decisions. But it is information that's a little bit delayed, and it's only one piece of information that we're using as we try and do the planning for schools. The next slide shows some of the healthcare demand. Abby, maybe you want to expand a little bit more on this slide.
Yes, no problem. So this slide shows thus far what it's looked like for our hospitalized patients. This is a look, I believe this is more actually just the health partner system actually for cases and current hospitalizations, because I remember those numbers of 34 and 9 based on the communications I got yesterday. So what we're looking at here is you can see the surge that was back in late May, early June, and then numbers declining. And then we got a little more active and we started coming off quarantine a little bit, and those numbers have gone up, but not a lot. And they've been fairly steady as far as hospitalizations. It's really important to know that there's a couple factors here of why we haven't seen an increase, despite the fact that we're starting to see maybe a few more positive cases overall. And that's because hospitalizations lag behind the actual positive case result. So that might go up a little bit. I will say that I feel so lucky to be in the state of Minnesota, where we have amazing collaboration with our medical care facilities and our public health departments, so that we can actually put in place the best testing and algorithms for not only testing, but for treatment of patients, and really work together to do what's best for our whole entire community. So maybe you guys don't feel this way, but I will say I really truly feel lucky to live here and to be a part of this medical community. It's truly an honor. I do feel that we might have another spike here, and if that happens, we have the resources that we should be able to handle this. As long as those numbers don't go up too high too quickly, we should be able to do it. And we've been able to prove that with that first spike and how we were able to handle it. So this is all about cases by age group. As you can tell, our largest age groups now are in our younger set. 20 to 24 is coming in at 9,166, and then our 15 to 19-year-olds at 6,000 in our total confirmed cases. Jill, do you want to speak a little bit more about these numbers, or even Jessica?
I think we're both deciding if we want to say more. It's helpful to break it down by age. It's a curiosity. We want to know what's happening in the age of our kids that we're sending to school. We want to have a better sense of which age groups are impacted differently. And age is just one way that we can break the information down and look at it. It gives us another picture. It's very, it helps, I think, and it feels reassuring to see that younger children seem to be impacted less. And that is something that we see playing out to some degree early on. It's very fair to recognize that kids weren't in priority groups to be tested. So there could be disease that wasn't recognized early on and wouldn't be captured in these numbers. But generally, it's been a very persistent lower number of cases in children less than 15 or even less than 19. And I think that's a great thing to know as we're heading into the school year. On the next slide, we actually took a closer look at how has that played out? How has the COVID cases played out in Washington County among children? And you can see that increase. And I think that definitely points to what I had stated earlier. When we first started testing for coronavirus, we just didn't have testing capacity to do everybody. We really focused on healthcare workers and high priority groups and people who were really symptomatic. And so it's very logical and understandable that the number of kids that were showing up with the disease was a smaller number. Important on this slide, I think, if you're paying attention to the numbers, to know that the count is the total count. It's not the number in that particular week, but it's a cumulative count over time. And so obviously the trend line goes up because there have been more identified, but it's not an extraordinarily greater number in August that we saw earlier. It is higher and there are more kids, but more kids are being tested now.
And I would probably echo that same sentiment in that it's not necessarily more children that are getting positive now. It's just more testing, and we're seeing that in clinic as well, with being able to test more and more children. And so then thus we're going to have higher numbers.
So how do we protect ourselves and others from coronavirus? There's three major things that we can do to protect ourselves from coronavirus. That is social distance, which we've heard from the beginning, staying 6 feet apart whenever possible, wearing a mask, and good hygiene. Overall, those are the three biggest things that you can do to prevent the spread. And then staying home when you're sick. And I think this is the biggest message that we can send to our parents, is to for teachers to talk to the parents and really reinforce this. Hey, you guys, if we want this in-person model to work at all, we need everybody to be on board with it. And that's going to mean if that kid comes down and says, hey, I got a scratchy throat this morning, they need to stay home, versus saying, you know what, I think you're okay. It's okay to go to school. They have good mechanisms in place for them to learn from a distance, and we need to protect our teachers, and we need to protect our other students and our community. So staying home and sick is super, super important. I kind of laugh at this cover your cough thing, because with a masking mandate, your cough will naturally be covered. But also, you know, if you can turn your head, you can turn away, you can exit a room if you're having a coughing spell. I think that's something that's appropriate to do. It sounds like the district has good plans for cleaning and disinfecting surfaces to also keep everybody safe. Anything else to add, Dr. Najarian-Bow?
You know, I don't think so. I think that was great. That's, you know, the biggest thing is going to be that, like we've said from the beginning, good social distancing, lots of good hand washing, and then, you know, our masks. So I think starting there and just being mindful of things, as I'm sure everyone is in this day and age.
That's right. So masks and personal protective equipment, PPE, which has become like, like a hashtag nowadays. It's so crazy. So evidence now really does support face coverings, this or masks. I think, unfortunately, coronavirus has gotten politicized, as so many things do. And so there was a great mask debate. We now have more and more evidence that's supporting, yes, indeed, masks work. So as a medical provider, for a long time, we've known, hey, if somebody's ill with something, you're going to gown up in the room. You're going to wear a mask to prevent you from getting it and preventing spread to others. When I do surgery in the operating room, I do it with a mask on. I don't want anybody to potentially get something that I could have while I'm operating on them. So we've known for a long time, masks help us contain infection and prevent infection spread. When that's really been looked at, it's been more like of a bacterial thing, however. And so I think this is where a lot of this debate came from. Now we have some epidemiological evidence. So looking at various counties and cities with mask mandates and looking at their overall trends of coronavirus and how much that's going up or not, we're actually starting to see evidence that actually the coronavirus numbers are going down, or that rate of increase is not as steep now that the mask mandates are in effect. As well, in countries that have masking is just more accepted, they have lower death rates than we do. So we are seeing this evidence really come full circle with that. And then Duke just did a study. They looked at masks. A lot of people have seen this study that said, okay, we're gonna have you wear a mask and cough, and we're going to see how many particles actually go into the air. And they have proven, wow, there's some cloth masks that actually work really well. And surgical masks work pretty darn well as well. And then, compared that to N95s and others. So getting into that, what do we wear? So I don't know if I said this at the beginning of the presentation or not, but nonetheless, I'll say it again. So I myself am immunocompromised. I have a really crappy immune system from having chemo a couple times. I was really nervous when we started back to work and came off of telemedicine and really got back in the clinic. Like, how was I going to do this? How was I going to stay safe? Should I even work? Then we came up with great algorithms, temperature screenings. We have mandatory masks for all of our patients. And for us, I, in the clinic, wear a surgical mask. And I feel totally safe around my patients. It was hard though. It was really hard at first. And the only way I've gotten this confidence about my workday is through doing it over and over again. I have patterns that I do when I get home. I only wear scrubs to work. And when I get home, I take those scrubs off and I head upstairs and I take a shower immediately. I don't wear jewelry to work. I wear my watch. That's about it. These are all things that I do to keep myself safe. Okay. So, I know that's not just about masks, but just thinking about yourself as a teacher, you may decide to wear different clothes that aren't dry clean only anymore, and that can be laundered easily so that you can do whatever patterns that you need to keep you safe and feeling safe. Maybe you wear your hair up more versus wearing it down, whatever makes you feel like you can be as clean as possible. So that's my thoughts on this slide. Face shields, gowns, gloves, I don't recommend them unless you are having intimate contact with somebody. N95s, these are for procedures like when somebody's in labor and I don't know if they have COVID or not, I would wear an N95. Short of that, unless they are coughing up, being intubated, potentially aerosolizing, we cause it, there's no reason to have an N95 that we're seeing. Surgical masks do just as good of a job at preventing the spread of just coming in contact in like a public way with a patient that's not that intimate of contact. As far as safely wearing, handling, and storing my mask, we'll get into that more in the next slide, but I just wanted to see if Dr. Najarian Bell had more to say on this one first.
And I think I'll go into more about masks and children on slides or a slide coming up, but similar for me. I am not immune compromised, but it was scary for me going back. So I was coming right off of maternity with a newborn, coming back to work, and so worrying about them, just because at the time we didn't know a lot how it affected really young babies, and never want them to get sick. And so coming back to work was scary for me as well. But similarly to Dr. Heller, I do the same thing. I wear scrubs. I used to wear clinic clothes to clinic, and now I've transitioned to scrubs and found some fun scrubs, and so that makes it more fun. But yeah, then changing and showering when I get home, wearing my hair up, which wasn't a huge problem because I do always usually wear it in a ponytail anyways. And then just kind of finding, those things where on the positive side, it doesn't mean you have to wear makeup every day, which is great. And then, just finding a routine for yourself. Not saying that all of those things aren't helping, because definitely wearing those scrubs, showering when you get home, those things are helping keep us healthy. But for me, it also is definitely kind of from a mental aspect and a mental health aspect, just kind of having that routine of this is how I go about it. And so otherwise things can just feel really chaotic if you don't have a routine that you go about every day. So yeah, I do kind of the same thing, and I would encourage you guys to do the same thing as well, because it definitely makes me feel safe in clinic. It makes me be able to interact well with my patients. I felt like the first couple of days after coming back, I felt it was difficult for me to make eye contact with people because we were wearing masks and shields and everything. And as I got into more of a routine, my patients can see me smile, they see my eyes smiling and they can see that. And so that has really brought me a lot of joy. I mean, even 6-month-old babies will smile back at me now while I'm wearing a mask. And so, it's just amazing what we can, what they can get from us. And so, it is definitely, now that I have more of a routine, clinic is really still such a joy.
So looking at how to wear your mask effectively here. So first things first, before you put on your mask, you need to wash your hands. And then you are going to be really cognizant of getting that mask over your nose and mouth. I don't know how many people, you guys, I wish I had a mask right here to show you, but that's okay, I don't. They're all over my house, so you'd think I'd have one right here. Anywho, that it's like this, it's right underneath their nose. And I think it's because it's uncomfortable or they're fogging. And that's why they don't get it high enough. It's really important that it's over that bridge of your nose. Your nose expels just as much as our mouths. So, if you think about it, when you're breathing, we aren't always breathing out our mouth, we're breathing out our nose. So make sure that that is up over your nose. It's one of these things that when I see patients and they don't, I'm like, push that thing up there. Come on now, you can get it up there. So you know, make it kind of a joke even with your students, because they may have this issue as well. Come on, guys, we got to get our masks up here. Okay, that's how we protect ourselves. So up here and then over your chin. Okay, those are the spots. You're going to use those ear loops to put it on. Also, I would experiment with various different masks. I personally like masks that go around my head. I like the elastic that goes around my head and my neck much better than the ear loops. Everybody is different though with this. So find the mask type that works for you. But here and here, it needs to cover this area. It really helps when there's wire in this area to give you that ability to pinch it so you don't get fogged, okay, if you wear glasses especially. And then you're going to go around the ear loops, kind of smush it into your face, and then don't touch your face. Keep your hands off your face. It's really, really important, okay? When you take it off, let's say to eat or something, you're gonna drink a sip of water, you're gonna just take it off via an ear loop, or you take it off from the back, okay, if it's going over the back of your head. And again, don't touch that mask, okay? Wash your hands if you ever touch your mask and have to like re-don it for some reason. If it is a disposable mask, throw it away. After you've worn it, we wear ours for the full day. After you've worn it for a day, throw it away. I would not recommend reusing disposable masks if you can help that. Cloth masks, launder them every day. I know for my kiddos, I'm going to send them with 2 masks to school. There's going to be the pre-lunch mask and the after-lunch mask. And we'll see how well that works. I don't know. It may not work well at all, but I'm at least going to try it for them, give them the benefit of the doubt that they can handle that. And then good hand washing. Wash your hands. Crazy wash your hands before you eat, especially. Any other comments?
Well, and I have a mask here, so I can, and people probably know, but yeah, so there's definitely people who wear it more like this. So always above and then making sure that it's nice and on that bridge of the nose. But it's happened before, and even my own mom initially was like, oh, well, I just wear it below my nose. No, so talking to them about, or everyone about how important that is. And then there are ones, which I'm sure you guys have seen all the different kinds, but I like ones as well that kind of have the go behind your head and have that stretchy part, just because otherwise it starts to really bother my ears. So yeah, biggest thing is kind of that covering the nose and the mouth as well, and then good hand washing and then with kids, just those more reminders of trying not to touch the mask, which is maybe a little bit easier said than done at times.
And mask wearing isn't something that we were really, really accustomed to. And maybe with the mandate, people are getting more familiar. But I think as school staff and teachers, one of the things I've realized at home is that the example that I set for my kids and my family, and when I'm out in the community, other people catch on and take their lead. So I'm certain that the kids in your classrooms will do the same. As you set that example, and Abby, you did such a great job with those gentle nudging, like, no, push it up on your nose. As you're doing gentle nudging with others, people will catch on, and I think the compliance and the willingness to make it a normal part of the day will come very quickly.
And I think, for children, they, once they comply really well sometimes, and I think as masks become more and more normalized, it's, every kiddo, every, toddler on up knows that we need to buckle our car seat when we get in the car, and we're not leaving until our car seat's buckled up. We need to wear a bike helmet when we're biking, and those things are ingrained in them by us as physicians, as parents, as teachers. And so just like a mask, if they start to see that that's more of a normal thing, just like buckling their car seat and wearing a helmet, then they're going to see that, yeah, well, when we go out, we're going to wear a mask. So
Yeah, I agree. I feel like the first couple months after we had to wear these masks, I thought to myself, I was on labor and delivery, and all of us were complaining, oh, these masks, they're horrible. I'm so tired of wearing these masks, right? And somebody just kind of was like, no, I'm not going to. And I'm going, no, okay, I get it. None of us want to do this. Okay. We have to do it. Okay. Now it is so ingrained in us now that we've been doing this for 6 months. Honestly, I think it might feel kind of weird to be with a patient in a room without a mask on. And I never thought I'd say that. I've become so accustomed to it. So I do think it's something that over time will hopefully we'll just become more used to. Yes, I want people to see my facial expressions, all that good jazz. But for right now, to keep us safe, if this is what we have to do, I do think it's a small price to pay, and that in time, hopefully it won't feel so intrusive. So.
So I'm going to talk a little bit about masks and kids. So as Dr. Heller has already expressed, so the face coverings are really, they're a proven effective way to prevent the spread of COVID. And it can be challenging, however, though, in children, especially because those young children do rely on faces to kind of read their world, the smiling and the different facial expressions. Although, like I mentioned earlier, I have, realized in clinic that kids are amazing. They pick up on just your eyes and you smiling through your eyes. And so some of those things have been really reassuring to me to be able to see that in children, but just kind of realizing that that's how they respond to their world, and accepting how they're reacting to things. I think some of the big things is there's a lot of myths out there about masks and children, or just masks in general. So you may be faced with a lot of those kinds of questions from parents or even children. And so, one of the big ones is wearing a mask going to be harder for them to breathe? And it really is not. Their oxygen is going to be just fine. They're not going to have low blood oxygen levels from wearing these masks. The cloth masks are really made from breathable material. And so they should not, children over age 2 should really safely be able to wear a mask. It's not going to affect their lung development. Because the oxygen kind of flows through and around the mask, and then it's going to block that spray of any of their respiratory drops. It doesn't trap that carbon dioxide in there. I know we've just been hearing a lot of those kinds of things. And then it's not going to weaken their immune system. It's not by putting their body under stress. So a lot of those different kind of myths that are circulating out there, I think can definitely be squashed with that knowledge that we can bring to the children, and talking to them about it as well. Every child's a little bit different. Some are really excited to wear the mask because it's either something that they're used to already, or something that's fun and new. But some are going to be more cautious or anxious. Every kiddo has a little bit different of a personality, so kind of identifying that. I think the biggest thing is just going to be open and honest with the children. I have, my 4-year-old, I was a little worried on if she was going to be able to wear her mask or not, and just talking to her about why we're wearing it, and that, I think children over age 3, you can focus on germs. You can talk about that germs are special to your body, and we want to make sure that they stay on our body or in our body, and the masks help us keep our germs to ourselves. And so I think that can be shared with kids over 3, and then for the younger age kids, it gets to be a little bit harder in explaining things. You can talk about being sick, but I think in those older kids, talking about how they're being such an awesome tool in protecting others as well as protecting themselves. Having a day where you kind of practice putting your mask on and showing kids how to put masks on appropriately, and reminders of that needs to be up on their nose and not to touch it. And then, if families do have questions about, what kinds of masks and how to wear masks, having those options to them or directing them to appropriate websites. I think the AP Healthy Children has some great resources for families out there on just different questions about masks, how to wear a mask, how to be safe kind of during these COVID times. And then some things that we have been getting is just do all children need to wear masks? And especially in our asthmatics or immune compromised patients, or people asking for exceptions. And really, there's not a whole lot of patients. It's very, 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 very rare that we're going to have an exception for somebody wearing a mask. So we're not writing letters for mask exemptions. If parents are so worried about their kiddo, then they should probably just be doing distance learning. And so I think that has also been a piece that we've been seeing a lot in clinic. And so all children, for the most part, should be able to wear those masks. Anything else that you have to add to that, Dr. Heller?
No, I thought that was great. I love the part about germs. Germs are important, and it's important that they stay on your body. I think that's a great way of explaining it to kids, those younger elementary kids that might not get it quite, but they'll get that. So I love it.
Yep.
So what if you have symptoms of COVID-19? If you're having any sort of symptoms, you need to stay home and isolate, and you need to contact your local healthcare provider to find out if you need to be tested. We'll get into how that works in a little bit, how that testing works, but the criteria for staying home is you need to stay home until you've had at least 72 hours, have passed since resolution of fever without any Tylenol or ibuprofen, and you have improvement in respiratory symptoms, and 10 days have passed since those first symptoms appeared. You're going to treat yourself with lots of rest, fluids, Tylenol, ibuprofen if needed. And then if your symptoms are severe, you're going to need to go to the ER or call your primary care clinician. We haven't figured out yet how to, is there medicine that could treat COVID? That would be great. Until then, this is how we treat it, like we do any other sort of viral illness, is with supportive measures. There's no other magic anything out there that's going to help you through it other than time and rest and fluids.
And I also would just say too, really, if you are having any of those symptoms, staying home is so, so important. I think we are such loving and hardworking people that we don't want to take one for the team, but taking one for the team is going to be doing it at home and being home, because we don't know if you have COVID or not, and then spreading it to other people is not going to be good. So staying home instead of working through any sort of symptoms is going to be so, so important, because I know it is so easy to say, oh, maybe that little cough or that tickle in the throat is nothing, but important to realize those things and take care of yourself.
And jumping off of that as well, I think for a while there was this thought or myth about, it got said by the CDC, well, asymptomatic carriers, there may not be a thing as asymptomatic carriers. That got retracted. Just want to put that out there. There are such a thing as asymptomatic carriers. And even more than that, what we call pre-symptomatic. That people just don't know that they are sick yet. And so you can spread it in that way. And so that little tiny tickle in the throat tomorrow might be the cough. And so that's where those tiny symptoms that might be something, just keep them home. Just keep them home. It's better that than paying the price of a few potential infected classmates or something. So asymptomatic and pre-symptomatic is real. They can spread, they can infect others. So just please adhering to those guidelines and making sure your parents understand that as well.
Hello, I'm Paula McDonald from Stillwater Schools. I'm the Health Services Supervisor. I'm not sure if I was taking the slide or if Carissa was going to pop in on this, but this is kind of just a summary page of some of the safety measures that we have put in place before kids come back to school. So you'll see lots of little bulleted points here and talks about cleaning and some of the things that we're doing as far as physical distancing and how many students can be in each classroom and the way we're going to space desks so they're 6 feet apart in classrooms. There's information about masks and face coverings and what to do if you need an exemption. There's information on here about hand washing and talks about all the new hand sanitizing stations we put at every classroom door, that we're going to take regular breaks to wash our hands and have students wash their hands, especially before they're eating, coming in and out of the playground, after using the bathroom. So lots of extra hand washing this year. Also, the bottom right corner talks about screening, and we are going to rely on parents and families to screen their own kids and for staff before they come into work, to stop and just think, okay, do I have any symptoms of COVID? And kind of tick down this list as far as, do I have a new cough or any shortness of breath? We're actually doing a cut of a 100.0 for the fever, being a little bit more conservative than 100.4 even. Do you have any chills, muscle aches, sore throat, scratchy throat, loss of sense of taste or smell, or any GI symptoms like vomiting, diarrhea, or nausea? Those are going to be all reasons not to come to school or to leave if you should feel that way in the middle of school. So lots of work's been happening over the summer to try to get us ready for kids coming back soon. We were trying to really simplify for people, what does it mean to be exposed? Because it's different if you walk by somebody that has COVID versus if you have spent some time with them. So if you spent more than 15 minutes, you have been closer than 6 feet, that is considered a close contact and a possible exposure if you come in contact with somebody that becomes positive for COVID. And that we also look back 48 hours. So if a student was in school on Wednesday, then we're going to look back to see, who they were in contact with on Monday and Tuesday. And all of those people are going to be considered close contacts. This is kind of a visual diagram of what takes the same information off the Minnesota Department of Health decision tree for people with COVID symptoms that we're using for youth, students, and childcare and staff. So it just kind of walks you down an algorithm of questions. So if I have any of these symptoms on the far right, then what am I going to do? I'm going to stay home. I'm going to talk to my doctor. I'm going to consider getting tested for COVID. If I don't have any of these symptoms, kind of the middle algorithm, then I'm just going to continue practicing my social distancing, wearing my face covering, washing my hands, getting enough sleep, eating right, exercising, trying to stay healthy and prevent getting sick. If you get a laboratory test, then on the far left kind of takes you down that algorithm as far as, what if my test is negative? Well, even if your test is negative, we're still going to ask you to stay home for at least 10 days, 24 hours without a fever, and until your symptoms are improved. And that's because, as Jill Tim talked about earlier, that when you get a test or when we give you data for a day, it's a snapshot in one day. So you might be negative today, but 3 days later, you might be sick enough and have enough viral load to now have a positive COVID test. And during that kind of uncertain time, we don't want people coming to school or, you know, exposing other people in their personal and school and private lives. So if your test is positive, well, then that's pretty clear. You have a positive result. You're gonna stay home. Same directions: 10 days, fever less than 24 hours, and until your symptoms are resolved. If you are sick, your family, household members also need to stay home sick. And then far to the left, it just gives you the question: what do I do if I'm just waiting for a test result? Same thing. You need to stay home until we hear the result and make a determination. And you probably went for a test for a reason. You were suspicious that you were tested, and so you're going to be staying home too, waiting for 10 days to go by. We're going to take this very, very seriously this year. This is how we're going to stay in school, like Dr. Heller said. This is our ticket to staying in, is if everybody follows the rules as far as having symptoms or being exposed and staying home, either sick or staying home on a 14-day quarantine. That's what is going to prevent us from spreading it throughout the schools. Next slide. So what are we going to do with a positive case? So if a student or a staff becomes infected, they're going to need to stay home for 10 days. Anybody that's been in close contact with them will stay home for 14 days. We will be calling each person that has been in close contact with the COVID positive person. So if a student is ill, we would contact all the other students in that class, and we would contact the teacher. If the teacher is ill, then all the students are contacted, and that whole group as a pod is going to go out on quarantine and move to distance learning. If the teacher is well enough, you know, to still teach, then she can teach distance. If she's sick, then we're going to need a substitute. So then we're also going to notify the building. So in order to, you know, kind of prevent the rumor mill, we are going to notify people in the building that there was a case in a classroom or wherever the case arrived. We also are then going to contact trace, were they on the bus? Did they intermix with the art teacher today, the music teacher today, the media specialist teacher? So who all were they in close contact with during the day of symptoms and the 48 hours prior? We are going to have a partnership with Washington County and Minnesota Department of Health to notify them whenever we have a positive case. We've already been doing this over the summer and the spring when we ran childcare, emergency childcare. So we're kind of used to that drill already. During the event that we start to have a lot of kids or teachers or staff sick, then we're going to look to Minnesota Department of Health and Washington County to help us determine whether we need to close a section or a building or the whole district, or do we need to even go to that bigger level on the dial and back up to everybody back on distance learning. So we are going to not be making that decision on our own. We're going to be working with our partners to decide when we're open and when we're closed. Do you want to say anything more about that, Jill?
Thinking that it's really important to emphasize how complicated it can feel to people when you start thinking about people with symptoms and people who are sick and who gets notified and what's going on. And one of the most helpful things I try and impart to people in the community in general is really focus on the prevention measures and the mitigation things that you can do, like the great hygiene, the mask wearing, the social distancing, and really try and emphasize with parents and students to stay home when they don't feel well, and then trust and know that the school administration and local public health and the Department of Health will help all of you sort out what it means if you're a close contact and what it means when you have to stay home and how long you have to stay home or how long families should stay out. That those decisions don't have to rest with individual classroom teachers or staff, that there's so much support from the health department and school administration and the state health department that collaboratively those contacts and those notifications will be made and will be really thorough in educating families about the best recommendations. Because it can start to feel overwhelming when you start to wonder, is it supposed to be 14 days? Is it supposed to be 10 days? And do I need to be out? And who else needs to be out? And I just don't think school administration is going to expect any classroom teacher to have to digest all that and make those decisions. So to continue to place your effort and emphasis on what can I do to keep us all healthy when we're in the classroom is really, if you're trying to figure out how to digest it all, that's where I would start.
Great, thank you for that. Testing, I'm going to hand that back to the doctors.
So testing matters for COVID because we want to be able to accurately track our community rate of COVID so we know what to do. What can our schools be open? Can our businesses be open? Is this safe for us? Is it not? Is what we're doing making a difference? Is masking working? If we aren't getting tested for it, we don't know if any of that's working or not. So it's for data collection and to understand the threat of COVID to our community. So ultimately, I view it as an experiment. You know, we are in a big experiment right now. We are seeing, do our measures matter? Is this working for us? And we'll see that by that level of COVID, by the number of hospitalizations, by the number of ICU hospitalizations, and by the death rate. So taking all of that into account is how we make decisions to keep our economy and our society up and running. And so that's why testing matters. Okay. As far as criteria for testing, this has been changing literally on the daily. And this depends on how much reagent and testing supplies we have. Like I said, we've been collaborating with all the hospitals in the state of Minnesota to ensure that the people who definitely need testing can get it done. Sometimes there's an excess of those supplies, sometimes there's not. And so that's why sometimes it opens up for, oh, asymptomatics can be tested. Oh, wait, nope, now they can't be. So when you think you might be exposed or you have a symptom of COVID, what I recommend is going to that Minnesota Department of Health link. Should I get tested for COVID? Or your own app. You can go to the Health Partners app and it will direct you oh, look at, yep, I'm going to follow this algorithm and it says that, yes, I should be seen. So then you're going to contact your primary care for a video visit. And the primary care will go through it and say, oh, look at, you're actually a really low risk person. We don't have enough testing supplies right now. So you're going to do X. We're going to treat you as if you have it, essentially, or we're going to quarantine you because we can't test you, or we can test you right now. And they're going to order that test, and then you go through a drive-through testing site. The drive-through testing sites are actually pretty simple, easy to use. And from what I've been hearing from patients, it's a variety of experiences from, oh my goodness, they touched my brain, to that didn't hurt at all. So, and this is all, everybody's different in their perception of pain and everything, but I think overall it's a simple test. So I think that covers how to get tested and who should get tested. Any other comments there?
Yeah, no, I think that is perfect. I think reaching out to your primary care provider for that video visit is going to be really key, because otherwise you most likely will get a big stop sign before you have that video visit, at least now. And I think, unfortunately or fortunately with things, there is so much changing and we're learning more and more every day, but also with testing supplies. So not always being able to test those asymptomatic, or if you had a contact, and that's what we're running to a lot in clinic as well. And so, just touching base with your physician is going to be the biggest thing. And because they'll know who or what the testing availability is and how to approach it. But I've had experience with the drive-through testing for one of my kids, and it was very, very easy, not painful, very simple to go through and tolerated it very well. So not a big scary thing. So at least that's always good to know, because sometimes for you and then also for children, it can be kind of a scary thing to say, oh, are you going to go get tested? So
I just want to add that the Minnesota Department of Health or Minnesota Department of Education and the governor has offered one saliva at-home test kit for every educator and staff in schools. And so the teachers and staff will be hearing more information about that, but they will have the ability to do an at-home saliva, like spit into a test tube or a vial and mail that off for a test. If say in the middle of the winter they're in bed with body aches and really ill and they want to just do an at-home test and mail that off, that each staff person at the schools will have access to one of those tests this school year.
And I would also just point out one more thing, that just from a pediatric standpoint, that immunizations are going to be so important this year, because we have those for our well child visits, and making sure that kids get all their vaccines updated. I know there was some hesitancy initially, but at least if we can protect our kiddos from those things that we already have resources for, is going to be amazing. And then the flu vaccine is also going to be coming out here in September. So all those things are going to be really important for you guys and for our kids.
Well, I will close us here. I want to thank all of you so much for participating this morning. This has been wonderful information. I think will be really helpful to our staff as we get ready to kick off a very interesting new school year. We appreciate the partnership that we have with Lakeview and with Washington County. This is health is something that we haven't had to focus on so much in the past. We are educators, and so for us to be concerned about health and safety to the level that we are during a pandemic is kind of new for us, and I think there's a lot of concern and just apprehension because it is not our wheelhouse. So we thank you for your expertise and providing us with a lot of great information. I am sure for all those who have watched this, they probably have even more questions. So I'm very excited to announce that our doctors are going to provide even more time with us to answer some live questions and answers on Thursday, September 3rd. So for our staff, they can go to our website and learn more about how they can connect to that. That's at 7 a.m. on Thursday, September 3rd, and would encourage them to come in if they have additional questions that they want to ask, and our doctors will be there to help. So with that, I want to wrap things up. And once again, thank you so much for your time. And to our staff, thank you so much for the work that you do. We know that this is definitely a different start of a school year. We usually have a lot of excitement, and this year I think there's apprehension mixed in with that. So that is fair, that is valid. We are all feeling it, but we are all in this together. And thankfully we have great supportive partners to help us through it. So with that, thank you again and have a great day.
Thank you.
Thank you.